All right, so we're here in the medication room, just checking on my orders for my patient. Patient is Erica Track. I've got 2 medications for her right now, which is ciprofloxacin, antibiotic, and ciprofloxacin antibiotic, 400 milligrams, and 200 milliliters of D5W, and then ondansetron, 4 milligrams, PRN, IV push. So I'm going to drop both of those from the Pyxis. So Cipro first. So I get my Cipro. It is 400 milligrams in 200 milliliters of D5. Got it. Set that aside. And then I will get, that is IV hang. So I'm going to also get the primary infusion for it, which is 0.9% NaCl, normal saline, and it is 1 liter pushed at 125 milliliters an hour. I'll get that with my secondary. And then I'm going to get also ondansetron, Zofran, which is 4 milligrams, PRN IV push, and it is 2 milligrams to milliliter. So we will be drawing up 2 milliliters. And the vial is 40 milligrams for every 20 milliliters. So we're for 4 milligrams, we only need 2 milliliters, which will be 4 milligrams of medication. So I've got all of my meds. I'm going to quickly do my 5 rights while I'm here in the bedroom before I draw up my medication. I have for my Zofran is the right patient, right med, right dose, route and time. It's due now. And then for my ciprofloxacin, it is the right patient, Erica, right medication, Cipro. It is the right dose, 400. It is the right route. It'll be IV push, and it is due now. So I did all that. I'm going to draw up my Zofran. Zofran is IV push, so I'd have to look this up either now or before to make sure I know how quickly to push. And Zofran is pushed over 2 to 3 minutes. So when I'm giving it, I'll push it over 2 minutes. I'm going to get out my 3 milliliter syringe and a blunt needle to draw it up. I need 2 milliliters for 4 milligrams of medication. Almost. Come on. A little bit extra. Make sure I have my 2 mils. Recap my needle. And I'm going to, not want to recap. And then I'm also going to make sure to put the label on it. Make sure that the barcode is visible. Okay, got my Zofran. I have my other 2 medications. I'll log out of the MAR here. And then I'll make sure to get all my other things that I need. My 2 flushes for my 2 10 flushes for my IV push, secondary and primary tubing for my leave this here in the bedroom because I have the scanner on my thing. I have the oh, and I forgot to do it, but I would do it. I would wipe off the top of the medication for 30 seconds before. I forgot to do it, but I would make sure to do it when I'm actually giving the medication. And then also, before I go into the room, I have a tag to change out the tubing for my primary. I'll just put it on there now, that way I don't forget. Good. Then I'll take all my stuff, go into my patient's room. Hi Erica, it's Luke. I'm your RN today. I have some medications here for you. Can I just get you to verify your name and date of birth? And she verifies it 2/9/2003. That is right on her wristband. I'll check it on the MAR as well here in the room and make sure that it's correct. And it is. Any allergies, Erica? Just mangoes. Okay. Don't have to worry about them or any of the medications we're giving you. I have 2 meds for you. I've got ciprofloxacin, which is an antibiotic that your doctor ordered for your infection, and I also have some Zofran for your nausea. So I'm going to get those real quick. I'm going to scan everything in. I'm going to do my 5 rights again real quick before I scan everything in, making sure everything's right. So Cipro is the right patient, Erica, right medication, Cipro. Ciprofloxacin, it is the right dose, 400 milligrams, is the right route, IV, and it is the right time, noon. It is due now. That is good. Same with my Zofran. It is 4 milligrams in 2 milliliter syringe. It is the right patient, obviously Erica. It is the right medication, Zofran. It is the right dose, 4 milligrams. It's the right route, IV push, and right time. It is due now. I have all that. I'm gonna go ahead and can I get your wrist real quick? I'm gonna scan you in, and then I'm gonna scan both these med zones. All right. It's not working right now, but it will work. Scan that in. I scan in my Cipro. I scan in my Zofran. And the Zofran works. And then it's gonna ask me everything about it, so I'll just write down what it is, what I have. So 4 milligrams of Zofran, 4 milligrams, rate 2 minutes, 2 milliliters a minute, 1 milliliter, 2 milliliters over 2 minutes. And then location in the left arm where the IV is at. Good. That's I. What the heck? Upper arm left. Good. Close. Everything's scanned in. All right, Erica, I'm going to give you your Zofran first, and then I'll hang your IV antibiotic. Is that all right? So let's position this like so. I'm going to first flush your line real quick. I'm going to assess the line and their surrounding area just to make sure there's no. Just to make sure there's no edema, swelling, etc. Let's see this one. I do this for 30 seconds. Flush the line, make sure it's patent. It is. Everything seems to be working. There's no edema, swelling, redness, infiltration, etc. Then I get out my Zofran. Cool. I just flushed it, so we're good. All right, ready? This is pushed over 2 minutes, so I do my first milliliter over a minute, and then my second milliliter over the next minute, making sure if there's no pain or anything while it's getting pushed through. Ask Erica, are you all right? Does it hurt? Anything abnormal? Good. This back over here, and then flush it one more time to make sure that the line is clear. Flush it my last time. Boop. And we're good. Close this up for now. And then I'm going to get started on your ciprofloxacin. I got the regular right here. Set up. I'm going to prime my line. I scanned it in. I'd be going over my 5 rights right before I gave these again, as well as with my Zofran as well. Making sure that it's the right route. Patient, dose, 400 milligrams. Make sure, again, my last checks here. 400 milligrams and 200 milliliters D5W. It is, we're good. It's the right patient. It is the right time. And IV is the right route. So everything is good. Get my primary tubing. Leave my secondary here for now. Got this. Make sure it's clamped down.
Draw out 2 milliliters of air. And I've got my blunt needle. Careful not to touch it. Connect my syringe. Keep the cap off. I'm gonna push the air in first, and then draw out our medication.
Okay. Just gonna prime in here.
Air bubbles.
Make sure there's no air bubbles. Take off my cap.
Recap my blunt needle
Okay.
and attach
Mm.
my syringe cap.
Fill up my chamber.
I've already
About
got
half.
the label on my
Good.
syringe. I'm gonna take the rest of my medications and we'll also grab primary, secondary tubing, as well as some saline flushes.
Looking for any air bubbles or big air pockets in my line, and I don't see any, so I'm gonna call that good. I'll recap this. Actually, what I'm gonna do is I'm just gonna attach it to my patient's line now. So take this, clean it off again for another 30 seconds because I dropped it earlier. That's good. Attach my to it. Good to go. That's there. That's good. Okay, cool. And then I'm going to hang my secondary.
Okay, so I did bring in your.
I'll change this so it's lower, but I'm gonna do it by gravity, so it'll be a little bit easier when it's already up.
Antibiotic treatment and just some saline solution to help you get hydrated, alright?
Do this. Make sure that's clean.
Hand hygiene.
30 seconds.
So I'll go ahead and
Make sure
set
the
up
clamp
everything that
is
I need and
secure.
we'll get that
Attach
IV
this there.
of Zofran to help you get nausea and your
And
hands
then-
burning, alright?
Help to be taller. That's okay. It's good. Fill this one up halfway as well, and then I'll back prime it once I get the line in the Alaris.
Scan all of the documentation. We've got our Cipro, other saline, and we've got our Zofran. So I'm gonna set up my primary tubing first.
Hold on. Let's just take this out here real quick. Yeah, of course.
Flip this so we don't spill.
Come on.
Go ahead and spike my bag. Fill chamber
Oh,
halfway.
maybe there's a kink right there. That's why.
And make sure to unclamp my line and
Just really doing this slowly.
clear it of any
He does not want to do it.
bubbles.
Okay. Line down. Line's down. Why is it not going? Line's down. Huh. It does not want to do that. Okay. It's fine. I'll just prime it normally.
Connected to our primary tubing. Find the optimal.
Good. It's here for right now. We gotta get another one of these.
About 15 to 30 seconds.
Wait for 30 seconds. Sorry about that, Erica. Okay, both my lines are primed. hang my primary lower than my secondary. All right. Now let's get this. I'd go check again just to make sure in the MAR, but it is 125 milliliters an hour for my primary, which is normal saline. Oopsie. Patient, yes. Yes, patient ID. This would be the ID for Erica. Confirm. Channel select. Basic infusion. I'm going to check real quick. I know what it was, but just to make sure that it's good. Normal saline, 125 milliliters. 1 liter or 1,000 milliliters. Good. Rate, 125. Enter. Volume to be infused, 1,000 milliliters. Then we go to our secondary, which is going to be ciprofloxacin. I already did all my checks and made sure I scanned it in, so we're all good there. It is 400 milligrams and 200 milliliters, so we'll click that. Is that correct? It is 400 milligrams, 200 milliliter diluent dose, 400 milligrams. Good. Next. Then we can hit start. Check that, make sure all my, I think my lines are still all closed. It's dripping. It was. There we go. It's dripping. It's running. Make sure to check for patency still. Is it y'all right, Erica? Does it seem to be working? Good. All right. I am gonna check on my patient again one last time before I leave. Ask her if she needs anything else. Make sure that everything's running smoothly, that it's not painful or anything. Lower the bed, lock it, make sure she has her collar, etc. Then get all my, I put the tag on. Seems a little bit screwed up. Okay, good. All right, Erica, I'll be back in a minute. I'm just gonna go document everything. Let me know if you need anything, all right? Take all my stuff out and go document.